What's up, everybody? This is Mike Ward, and we are at the nurses station. How's everybody doing tonight?
Doing great.
Everybody's good? We have some great stuff tonight, guys, and we apologize. It's taken us so long. We like to, it's the entrance. It's all about the entrance, right? So now that we have everybody's attention, tonight we're going to finish our final episode of Road to NCLEX, and we have a very special guest tonight. We have our very own nurse, Tim, who actually writes for NCLEX. And this guy is going to bring some serious value tonight. He's going to drop some serious knowledge bombs. So let's get into it. And Blake, why don't you take it away for me?
First, can you say something, Tim, so we make sure your audio is working?
Well, I'm glad to be here, and I really do hope my audio is working. So,
all right, good. That was our test, everybody. We apologize. I'm going to read your bio here real quick, and we'll get going. So, Dr. Tim Bristol is a faculty development and curriculum design specialist. He is taught at all levels of nursing, to include LPN, ADN, BSN, MSN, and PhD. By developing new programs, innovations, and learning and helping programs internationally, he is an expert in bringing the evidence base of nursing, healthcare, and education to students and faculty at all levels. Through consultations, writing, and mentoring, Dr. Bristol assists his faculty identifying the competencies needed to effectively enhance programs for optimal student outcomes. He has certification as a nurse educator, is a fellow in the Academy of Nursing Education, and is internationally known for bringing excitement through success to his colleagues and students. And his motto, I love this motto, Tim, today we will learn how to learn. So thank you for being here, Dr. Bristol.
Thanks for having me. I appreciate it.
I'm excited, man. I'm excited to talk about this. And I know that we're not going to spend a whole bunch of time on the show tonight, because there's some really, really big things happening in the world. But what I'd like to know is, first of all, and by the way, I want to say congratulations, everybody. Dr. Tim Bristol, his son just passed his NCLEX, just graduated. And how old is he? He's like 22. Is that right? 21?
He turned 21 in August. Yeah.
Can you imagine? I can't imagine, man, being 21 and having my nursing degree. I mean, this guy's ahead of the curve already. Yeah. He can have his PhD if he wanted by the time he's 24. It's unbelievable.
I was 29 in my first nursing job.
Yeah, right. That's how I went. I think I graduated. So yeah, I graduated in 2008. That's 10 years from now. Oh my God, I was 31. I was 31 when I took my NCLEX in August. Last month, right? 10 years. So how did you get into to write and test for the NCLEX?
Well,
just for the NCLEX.
I do not write for National Council. That would get me in a lot of trouble. So
okay, I got you.
I help people prepare for NCLEX. I help programs write test questions that prepare their students for NCLEX. I help students prepare for NCLEX, a lot of NCLEX reviews. I do a lot of writing to help people understand where the NCLEX is headed, especially in the near future. So a lot of my articles, a lot of my writing, pretty much all of my consultations with students, with faculty, are helping people prepare. So.
Well, it sounds like you have a lot of insight.
Well, I've made a lot of wonderful discoveries that I'm very excited about when it comes to preparing for NCLEX, because I feel like we're entering an era where the bedside, as in what a nurse does day by day, is now going to start dominating nursing education. I think we're in an era where the students are going to see more and more on a day-by-day basis what nurses are actually doing. So when they're sitting in lecture, they're going to see a lot more of that nurse at the bedside. When they're in the lab, it's going to be a lot closer to what they're seeing in clinical settings. So I'm excited. I think we're in a fun era of education.
I tell you what, man, whenever I was studying for my NCLEX, I was so stressed out. I remember I think I took about 4 weeks right after I graduated just to begin preparing for that. And I remember we did like an ATI. So I don't even know if ATI is still a thing. Is it?
It is. It is. We have ATI and HESI, Kaplan. The NLN has some tools involved in the mix. And they try to replicate the NCLEX experience for students. And it is very stressful. In many environments, they treat that ATI exam like a final exam. And if you don't do well on it, it could impact your ability to pass that class, which is usually required for graduation.
Yeah, right. Oh, yeah, that's true. That's true. Well, I remember, and Blake, don't let me interrupt, man. If you want to, I don't want to ask so many questions that you don't get your chance. Because
I'm here. I'll jump in. Trust me.
All right, cool. All right. So I remember taking the ATI, and it was very, very cut and dry. Right? I remember thinking, wow, I wish all our books were just like this, because it just eliminated all the fluff, right? So what do you recommend for students who are looking to take their NCLEX here pretty soon? What do you recommend that they study? What do they go after? What is it, that you've found has more success in prepping these students?
Well, what's happening right now with NCLEX, the people that write it are doing some extensive research on new nurses. And what we've discovered about new nurses is that only about 23% of them are actually ready for practice. And so what National Council is doing is, and that was a study that actually came out in 2017. They studied 5,000 new nurses over 5 years. And it turned out that only 23% were actually ready for practice. And so now what they're doing with NCLEX is they're writing questions more to what does the nurse hear at work? What does the nurse say at work? What does the nurse do at work? And so when you're studying, no matter if you're using ATI or HESI or Kaplan, if you get one of your practice questions wrong, you've got to do something with that question. Okay? You can't just read the question, read the answer to it, and go, oh, that's right, hypokalemia, I'm good to go.
Right.
And, sometimes students get frustrated because they have 4 options, 2 are kind of correct, which one is more correct? In nursing, you guys know this, you get 10 options. You walk through the door, there's 10 things you literally can do right now. Which one do you need to do first based on the status of that patient at that point in time? So students, when you get a question wrong, when you're doing your practice ATIs, when you're doing your practice HESI, your practice Kaplan, no matter what it is, if you get a question wrong, you've got to pause and do something with that question. Whether it's create an SBAR, whether it's explain it to another student, whether it's look up a quick 3-minute YouTube video on that particular concept or construct. You can't just go, oh yeah, that's right, hypokalemia, because you're going to fool yourself and think you're ready and you're not. You got to do something.
Yeah, we all.
That's good.
What I came to understand when I was studying, and I was happy enough to know that I passed the first time. But if those have been listening to this series, I was the guinea pig of the 265 questions. And the last 35 of them were select all applied. And, I started getting in my head and, I was like, I got to be doing well because I keep getting these questions, but at the same time, that creeps in your mind. But what I really did with studying is that, you're exactly right, Dr. Bristol, when you said it's not just the foundational knowledge. It's what's reality, what's realistic. And because this doesn't happen in a vacuum. You think you're taking a test and everything is black and white in that regard. And nursing tests themselves and NCLEX, which is even more on steroids of that thought process of application. And so you have to think outside the box. You have to, we preach in this profession, critical thinking skills. Well, that's what it is. But people really don't get that concept of what you're doing when you're on the unit. Your brain is going a million miles an hour. And people always ask, who are not in our profession, they come in and say, why are you so tired after 12 hours? you just walked around and you're on your feet, but it's not hard labor. And I always told my wife, which my wife's watching right now, so hi Melissa, but she oh feedback. Are you guys getting feedback?
I am not.
Really bad feedback. Hold on a second. Mike, do you want to take over while I get this fixed?
Yeah, sure.
Okay.
Turn your microphone off. I can hear too.
You guys sound great to me.
Oh, okay, great. There it is. It's gone. Whatever that was, it's gone. So I would like it if you could, give us some tips, some really great tips for all the listeners that are going to be listening to this, because I have imagined that there's going to be a lot of people interested in hearing what you have to say about maybe some strategies going, they graduated just today. What do they need to do from here on out?
Well, if you graduated today, I would assume that you'd be taking NCLEX in the next 30 days, maybe. Try not to make it a couple months. One thing that I've noticed, and pretty much any NCLEX specialist will tell you this, it usually is pretty difficult if you start getting out 45 days, 60 days past graduation or past your last nursing course. So I do recommend that you put yourself into a regimen of serious training, and by serious, you know what that means. It means that you're literally spending that 3, 4, 5 hours a day, keeping your skills up, keeping that brain power going until the day of NCLEX. Daily, you have to take care of patients. Okay. The NCLEX is all about what does the nurse do, that doing part of nursing. So daily, you've got to take care of patients. If you're not in a clinical setting, then you need to be making sure that the cases you're working on, the case studies you're working on, the questions you're working on are very much patient-focused questions. Be very weary of questions that you can answer by the definition of one word. Mm-hmm. If it's a definition of one word, it is not going to be on NCLEX. If it's a complex patient scenario, that's going to be on NCLEX. And you have to be careful too. If you can say, oh, this is a cardiac question, be leery. Most questions on NCLEX look like they brought multiple systems together. Blake, Mike, you guys know when you're caring for a patient, there could be 100 different things that come sneaking in the back door. You think you've got a cardiac patient in front of you, and all of a sudden you have a mental health concern, a GI concern, an integumentary concern. So that's what's going to happen with you on NCLEX. So you got to look for the patient in your prep, and really try hard to take care of patients.
That's good. That's all very good.
Yeah. So to finish, and I think that goes back to, again, what I was talking. I apologize. My headphones blew up there for a second, so I couldn't hear anybody. It was just a bunch of fuzz. But when you talk about a patient focus and how little background things can sneak into your daily life. I always, when I had my preceptees, I always said, textbook and reality are different. NCLEX is not going to be exactly what we do on this unit, but it's some sort of in between. It's okay to think, when you're going to a question, to think about, okay, in reality, when I was on the unit, though it doesn't present as black and white as it does on the NCLEX, in regards to, it's a little more vacuum than what you do actually in reality, but that's what it's trying to get you to. But it has to somewhat shape competency, so it can't be reality. But take reality and take textbook and kind of find the middle ground of how you approach certain situations, and that feeling that there's some vagueness that comes, and when you anticipated it correctly with your preceptor. Those are the things that you really have to focus on. That's patient. It's not like you sit outside the room and you're like, and contemplate and reflect about, oh, this hypokalemia, and we keep going back to hypokalemia, but
Right.
you know, oh, hypokalemia, and they presented with it. It's not going to do that. So that's why I told them, think of it that way, but then also just really read that question. And what is it asking you? Because it's going to throw a huge paragraph. Many of them are going to throw this huge paragraph, and 75% of it has nothing to do with what they're going to ask you. Okay.
Just junk. Yeah.
Yeah. So if it's asking for an assessment and you got 3 interventions in there and there's only 1 assessment, that's a pretty dang easy question. Even though that question might be a whole paragraph long, get rid of those interventions, you know, because it's asking for that. And that's what, and correct me if I'm wrong, Dr. Bristol, but they're trying to get you to critically think that way too. How do you depict what is being asked of you and critically think in that regard? It's not so much, you need the fundamental knowledge of nursing to be able to have the base knowledge to take it up 1 notch to actually do it in application mode. And that's what I think the NCLEX is.
You're absolutely right. And what we're seeing now, because of this research that shows us that, you know, only 23% of new graduates are actually ready for practice, what we're seeing now is a mix of assessment and intervention. Because think about it, Blake, you walk into a patient's room with the intention of performing assessments. If there's a priority intervention that you need to do, you got to do that first. Yep. If there's an intervention, you know, I joke around. I'm like, oh, I'm sorry you're laying on the floor. As soon as I get done listening to your lungs, we'll get you
right. I need you to just be really quiet, take some deep breaths. I'm trying to listen.
Exactly. So what we're seeing is, you know, what the new nurse has to do is a lot more complex, and you're going to have to make some clinical decisions. We're developing an entire NCLEX review that is completely based on clinical right now. And what we're trying to do with NCLEX reviews is take the student, take the candidate for NCLEX to the bedside and actually have them providing care for a patient. And the reason we're doing this is we're trying to help people start to better visualize the bedside. We know that next April, National Council has indicated that the difficulty of NCLEX is going to increase yet again. And what they're doing, one of the ways they're doing that is they're increasing this bedside focus. And so what we're doing with our NCLEX reviews now, we take you right to clinical. And in every activity that we do, you have to go to be that nurse for that patient. And so that's why I say to the students, you know, you get a practice question wrong, go to clinical, be the nurse for that patient. Pause for a moment. Blake, you said something really important. What is the question asking? When you go to take NCLEX, there's going to be a little dry erase board next to your keyboard. I encourage you, write down at least 1 word for each question you answer, because that word is going to slow you down enough to look at that question again. Just like Blake said, look at that question again. What's your focus? As you're taking your practice quizzes, students, have a notepad nearby, have a dry erase board nearby. Practice this skill. That's very important.
And so I know we talk, you know, we're very student focused in this series and everything, but I think you're the perfect person on here to not just focus on the students' role in the success of them. And I say that because, you know, being a preceptor, you know, and our organization, AAMN, we're all about paying it forward, all about developing those who come after us, because that's how our profession continues to mold and progress and become what we want in the future. We're always looking to make it better. And we need a very highly educated next generation to take it further than what we've taken it. And it's so important. And so in your position, what would you tell faculty who write curriculum, as well as the preceptors that are on the units helping these individuals to be successful. What should the faculty and what should the preceptor be focusing on? How can they help them to set them up for success?
Faculty have got to give their students in lecture, faculty have got to get their students a patient assignment, at least 1 per hour of lecture. You cannot talk to your students continuously, giving them more and more information without a patient assignment. And I'm talking even the first day of, you've got to do patients.
Mm-hmm. That is fantastic advice.
1 per hour. And these patients, you've got to do S-bars on them. Even in the first day of nursing school, that's okay to do. You might have to, it might be a little weird and you got to explain a little bit more. You've got to do focused assessment, as in, what 3 things do you need to know about this patient right now? Go. And you've got to start early. One thing that we know about NCLEX is the most important class in the entire curriculum is that first semester fundamentals of nursing class. Their research has shown that time and time again. So as we're exercising this critical thinking muscle, which National Council is changing to clinical judgment, as we're exercising this clinical judgment muscle, you got to start on day 1 with that exercise regimen. Patient assignments. Preceptors.
That's good.
Go ahead. Yeah. Preceptors, you guys are vital. One thing, the best thing that a preceptor can do with your preceptee multiple times per day, hey, let's say once an hour, you've got to challenge that learner. What are the top 3 things you are concerned about right now? Go. And you're building a habit. Critical thinking is not a destination. Critical thinking, clinical judgment is not a competency check, I'm there. It is a habit that you have to form by repetition. And so if you're a preceptor, do your preceptee a favor. What are your top 3 concerns right now? Go. And see how they do. And keep challenging on that. So that'd be the quickie.
Yeah, and I completely agree with that, Tim. And as you were saying that, I was just kind of chuckling to myself because those were, you kind of summarized what I did without me putting it down on paper of what I did with my preceptees. And the whole thing is, and this may have scared them off the bat, but they came in the first day. It's about ripping the Band-Aid off. I said, go in and do your assessment and chart. And they're like, what? And I said, I can fix charting. We can go back and change the charting. Okay. And not all nurses are like this. So I know that some are even more type A than I am. But if you don't let that rope out, a little bit, and, it's like the bird flying the nest, get in there. And of course, the first couple of days I'm in the room with them, but it's all about the delivery and how you make that environment from yourself as a preceptor to make them feel comfortable to make mistakes while you're there. And you make sure that they don't make those mistakes that will affect the safety and the quality of care that's being provided to that patient. But you got to let them think through things. And what I would do, we got to the point where they would go do their assessment and I would follow them right after they came back out. Once I've seen them do it 10, 15 times over that period, I know they know how to listen to lung sounds now. So I'll let them go in there. And if it's the second day, they've already established a relationship with the patient and family. So they're going in there and they come out. I go right in behind them. I do my assessment and I come back out and I say, okay, what's going on with this patient? And I had them go through that thought process over and over and over again. And it was so cool to see just over a month period of time of how they started to anticipate the things that are needed. And if they got to that certain point, I'd say, okay, what do you want us to do next for this patient? Even though in my mind, I would know what I would want to do for this patient. But as long as they could give me a logical explanation through the steps that they do, even though it might be different of how I would approach it, they're not me. So it's got to click with them. And if it's logical and it makes sense and everything, I'm like, cool, let's do it that way. Instead of I think a lot of times, and this kind of happened to me in some regard, is some of my preceptors or just clinical, nurses who were there through maybe my sophomore, junior year. It was all about how they did it. And if you don't match up with your thought process or the way you think with them, you get very frustrated and you don't get the reps at the critical thinking skills that you do. And I think that really sets you up for the NCLEX if you've gone through that process of really leaving that preceptorship, feeling like, okay, you're not going to feel like you're completely ready. You never do as a nurse, so that's normal. But you feel pretty confident of the reps that you've gotten, and so and I wanted to just before Mike's ask kind of the last question for plugs, because I know we can go all night, but Tim's got to get back to the Packers game. So, but Ryan said that, he kind of wishes the NCLEX was more like the RRT exams, 2 tests, 1 question, one all computer-based clinical simulation. So there'd be 1 test and then 1 computer-based clinical simulation. He goes, the new grads are going to hate me for saying this, but I think it all goes back to simulation. I think you see the most progressive nursing schools out there. They're really, really putting an emphasis on almost virtual reality simulation at this point. I mean, some of this technology is just absolutely crazy in regards to how they do these simulations. And I've gone through some of them, and it's just so cool to see in live time that even if you're not on the unit, you're able to get those reps in a safe environment. And I think even taking it one step further, and I don't know if some nursing schools do this, but to bring in RNs that are in conjunction with that school, if the health system is associated, if they come in and they actually run it, I think that'd be really, really cool. And then probably maybe already being done. But the more real life and the more camaraderie and the more feeling, especially in this millennial generation, I'm just going to be very blunt. We've got to feel like colleagues and to feel comfortable to make mistakes and to say our piece. And that's how we're going to help, I think, personally, make this gap up of when you say 23% of students are ready, is they've got to feel comfortable. They've got to have that confidence and have someone give that positive reinforcement when it's appropriate. And then, constructive criticism when it's appropriate as well.
True. That's very true. And you've got to encourage these students to be bold. National Council talks about, are your students able to argue for a change in the care plan? That takes boldness. That takes courage.
It does.
Because there's going to come a day when you got to go and talk to a physician. And I've been through it. And I know Mike has, and Tim, I know you have too. When you have to, we're an advocate for the patient. And how do you deliver it? How do you, because obviously you don't want to be confrontational, but you're a team. And to be an actual team, you have to contribute. And so when you see something, you need to speak out, but have a rational, don't just say it, have a reason why you're saying it, because they're going to add, that's going to be the question right behind it, is why. And if you can give them a logical explanation, I guarantee you, physicians, they welcome and all advanced practice personnel, they want to have that teamwork, but they want to know that you're competent. And so have that rationale behind it. So, absolutely. Mike, do you want to close this?
Yeah, let's close it out. Let's close it out. I just want to make sure, Tim, is there anything that you may have, maybe something that just popped in your mind? Is there anything out there that you would like to say to anybody that's about to take their test that you have not said yet? I don't want to miss any pearls. I don't want people missing out on some good stuff. I know you're just a load and wealth of information, man, and you've been dropping knowledge bombs all night. So and you really brought a lot of value. I just want to make sure we didn't miss one thing. Anything at all you can think of?
The only thing that I can think of is make sure that you're explaining some of these questions that you get wrong in your practice, in your reps. You got to explain some of these questions to someone else that you can have a bit of a discussion with. So call up a buddy, call Blake or Mike. Mm-hmm. Explain to them something you got wrong. I'll close with this. If you could summarize NCLEX in one word, that word would be safety. And the number one reason for safety problems in the American healthcare system, according to Joint Commission, is communication.
Mm-hmm.
And you can explain why you just got a question wrong to someone else that kind of knows what's going on, whether it's a buddy or a tutor, you're headed in the right direction. You're headed in the direction of NCLEX because they know that number one reason for safety problems. And you're going to see it on the NCLEX when you take it. You got to be able to communicate. You got to be able to talk about what's going on. And that's going to help you pass NCLEX. So
awesome. Well, I want to make sure I'm going to put up on the screen. We do shameless plugs. Tim knows this on the show. Being a part of the board of directors of AAMN, I want to put that plug in there too for you. We appreciate all of your service and your contributions to our organization and outside the organization. And but if you, he does have Twitter, he does have Instagram, so it's at NurseTim. So please, connect with him. He's a wealth of knowledge, and I know for a fact he will take the time as much as his bandwidth allows to help anybody who asks. So if you're out there and you're just struggling, ask Tim, ask myself, ask Mike, ask anybody in this organization. And I know we're on our public page, so a lot of the individuals listening to this tonight or in the future may not be members of our organization. And so we really want to let all of you know, whether you're male or female, you're welcome in this organization. We are all about supporting you in your personal journey in this profession. And we always aspire to do more and more of that, because we know that you're going to be alongside us one day and you're our future colleagues. And we respect that so much and are so happy that you are working so hard, because we know how difficult nursing school is and how difficult the nursing profession is. But it's one of high reward and high integrity. And that's why us three males up here are so proud to be alongside not only our male colleagues, but our female colleagues and the wonderful work they do. So please connect with us. We are here for you. And that is what AAMN stands for. So everybody have a great night. Join us. We're actually going to be on the public page next week too. Mike, do you want to do a little plug for that?
Yeah, so we have a Mr. Nick Atkins. You guys may have heard of Nick Atkins. He is the founder and creator of the Pink Socks movement, former healthcare administrator, and now TEDx speaker. You saw maybe on TEDx San Francisco. Check him out. Pink Socks, or hashtag Pink Socks, or just Nick N-I-C-K Adkins, A-D-K-I-N-S. Just a great guy, really, really super solid guy. And I would highly encourage you to check his TED Talk out on YouTube. It will blow you away. It's going to be an exciting interview. Same time next week, 8 p.m. Central Time. And it's going to be a lot of fun. I hope you guys can all join us.
Awesome. Well, thank you again, Dr. Bristol, for being here. And we hope that you come back, as I think we'll do this kind of when that time comes every, semester, to kind of give everybody kind of an extra boost of inspiration to be successful. So thank you so much. Everybody have a great week.
Good night.
Take care, everybody.